I'll be speaking from the subject COVID-19, an ounce of prevention is worth a pound of cure. And I'll briefly review the impact of COVID-19, importance of prevention, strategies to improve health overall, the benefits of COVID vaccinations, and dispel some common vaccine myths. So prior to March 2020, when the World Health Organization officially declared the COVID-19 outbreak a global pandemic, most had not even heard of coronavirus. But now, 1.5 years into this pandemic, coronavirus and COVID-19 have become common household terms. Unfortunately, if I were to poll the audience today, I would venture to say that there are very few who either does not know someone personally who had COVID, still suffering long-term effects from COVID, or has died from COVID. And I can say that with such certainty because the over 43 million cases the United States has reported and over 700,000 deaths. In fact, in 2020, COVID-19 became the third leading cause of death in the United States, second only to heart disease and cancer. Now, every death is significant because it doesn't stop with just that one person. No man is an island. And that one who died was someone's loved one, and the lingering effects of that loss will be ever present for years to come and is beyond the scope of this presentation today. But I encourage those who are struggling with the loss of a loved one to seek help and get counseling to help cope with the loss. The COVID-19 pandemic has highlighted a number of issues about our nation in that almost 75% of Americans are overweight. It has highlighted social and racial inequities in public health, as COVID-19 has disproportionately affected the racial and ethnic minority, putting those groups more at risk of getting sick and dying from COVID-19. Now, what do I mean by that? If you look at this graph from the CDC, this graph shows deaths from COVID from the beginning of the pandemic. The tallest peak on the left shows that in April 2020, African Americans were dying at a rate of two and a half times that of our white counterparts. Now, as the pandemic has continued, that has improved, but there are other groups of color and ethnicities that have also been unequally impacted, as represented by the gold peak in the middle, which is American Indians and Alaska Natives, and the blue, which represents Hispanics. A number of factors contribute to this, but to name a few, people of color have a greater incidence of underlying health problems. More of us work in service industries where we cannot work from home or physically distance, and more of us have less access to health care. We will briefly discuss some of these later when we review strategies for prevention. Now, we've all seen on television the coronavirus with its spike protein and crowns, and many have unfortunately experienced its effects. This virus is unlike other viruses in that it can affect most every organ in the body, including the brain, causing memory loss and brain fog, the lungs, causing cough and difficulty breathing, the heart, causing chest pain and inflammation, our GI tract with loss of taste and smell, and even our blood vessels, causing clots throughout the body, leading to stroke and pulmonary embolism. Now, I wanted to emphasize that treating COVID-19 is not like treating hypertension, diabetes, or heart failure, where you have a multitude of medications to choose from. And eventually you'll find that right combination that works for that patient. Treatment for COVID-19 is supportive. We have very few medications to actually treat COVID, and there is no cure. And because of that, prevention is key. Too often, the medical establishment focuses on treatment, but we don't spend enough time talking about prevention. The number one way to prevent complications or death from a disease, regardless of what that disease is to prevent the disease itself. Now, I know the concept of prevention sounds foreign to many because most of us are not wired to think that way. In fact, most do more preventive maintenance on their vehicles than their body. We get the oil changed, we get tires rotated and balanced, we get it waxed and cleaned up, and we can get another vehicle, but we only have one body and we need to treat it well. So what can we do? If you are overweight and you have a BMI of greater than 30, there's no time like the present to commit to losing weight. The goal BMI is less than 25. I mentioned earlier that 75% of Americans are overweight. There is a group whose incidence of obesity is even higher, and that's African American women. We have the highest incidence of obesity compared to any other group in the United States. 80% of us, or 4 out of every 5, African American women are obese or overweight. So what can we do? We can set realistic goals and we can take action. We can exercise. It's recommended to get 30 minutes of physical activity 5 days a week. Now, if you can't do 30 minutes, that's okay. Start somewhere. Small changes can have a big impact. We can eat well, which includes eating plenty of fruits and vegetables, decreasing intake of highly processed foods and fast foods, and decrease sugar consumption. We can take our vitamins and minerals to help build our immune system, get plenty of rest, take time to relax, and reduce stress. And if you smoke, there's no better time like the present to commit to quit. Lastly, we need to better manage chronic medical conditions. Now, first, we must know what those conditions are. Now, I'm not picking on you men today, but it's football season. And many of you can ramble off the stats of your favorite team or player. What are your stats? What is your blood pressure? What is your blood sugar? How much do you weigh? How much is it recommended for you to weigh? Have you had your prostate checked? Now, once those issues are identified, meaning we know if you know you have diabetes or you know you have high blood pressure, we should strive to better manage those and make our health a priority. Now, what more specifically can we do to prevent COVID? Many of you can probably ramble these off better than I, okay? We can practice the 3 W's. Wear our mask. It needs to be well fitted with 2 to 3 layers covering both the nose and mouth. We need to wash our hands with soap and water or hand sanitizer with at least 60% alcohol. And watch our distance, which includes avoiding crowds, poorly ventilated areas, and stay 6 feet apart. Another preventative strategy to get vaccinated. At the beginning of this pandemic, we saw the virus affect those who were primarily the elderly, people of color, and those with a lot of underlying health problems. Well, now this virus is drawing a distinction between those vaccinated and unvaccinated. Approximately 56% of the US population is fully vaccinated with COVID-19. Only 43% of Alabamians are fully vaccinated. But if you look at vaccine uptake by race and ethnicity, you'll see that African Americans have the lowest vaccine uptake at slightly less than 30% being fully vaccinated. Now, hospitals across this nation are reporting admissions for COVID, and they are doing it based on vaccination status also. So they're categorizing some vaccination status, but they're looking at admissions to COVID, they're looking at admissions to the ICU, those on a ventilator, the number of deaths. And so you can see here, I have Tanner's recent post. They have pictured those in the hospital. Those who have died from COVID are listed in the middle, those on a ventilator. The ones in the orange are the unvaccinated. Hospitals are trying to show the importance of getting vaccinated against COVID-19. More than 95% of the patients hospitalized for COVID across the nation are unvaccinated. Now, there are some that say, well, some still get hospitalized. That's true, but that's only a small percentage. And even those that get hospitalized after vaccination are 11 times less likely to die than someone unvaccinated. So when hospitals are full of patients with COVID-19, it impacts all of us. For every bed that is occupied by a patient with COVID, that is one less bed available to treat everyday medical issues and emergencies. That stroke, that heart attack, that blood glucose or blood sugar that's out of control, or even that blood pressure that's out of control. Right now, there are patients who have already delayed treatments and surgery for fear of coming to the hospital and contracting COVID. And we are seeing medical issues that could have been treated or managed more easily had the patient earlier. So COVID-19 vaccination is beneficial to all of us. Vaccines have a number of benefits. They have shown to decrease the risk of infection, decrease the need for hospitalization, decrease serious complications like ICU stay, mechanical ventilation, decrease the production of variants. And they also help produce those who cannot get vaccinated. And when we're talking about COVID-19, that's those who are less than 12 years of age. Now, if you look at other disease states, this same thing holds true. Tetanus, diphtheria, mumps, and polio are examples of diseases that were once common, but are now rarely seen in the United States, and that's because of vaccine. So let's talk a little about the COVID vaccine. Ones are available, how they work, who should receive them, dosing, and side effects. Currently, there are 3 COVID-19 vaccines available in the United States. Pfizer's vaccine, Comirnaty, is the only COVID vaccine that is currently FDA approved, but the other 2, Moderna and J&J, are available for use under emergency authorization. So how do they work? Both Pfizer and Moderna have taken a small piece of the genetic material of the virus, or mRNA. They've taken and wrapped it in a lipid coating. Now, this package can now teach our bodies antibodies against the spike protein. Now, Johnson & Johnson is an adenovirus vaccine. And what Johnson & Johnson have done is they've taken the DNA virus, they inserted it into a weakened virus that causes the common cold, the adenovirus. And now it can teach our bodies how to make antibodies to the spike protein. What does all of that mean? Okay, I like to use the analogy of a soldier in a battle. Every soldier must know how to do 2 things. Number 1, they need to know how to identify the enemy. And number 2, how to fight. The vaccines help us do both. They teach our body how to identify the SARS-CoV-2 virus that causes COVID-19. And they also prepare us for the fight by revving up our immune system so that it's primed to attack the virus. So let's do a brief review of the COVID-19 vaccines, and we'll start with Pfizer. Pfizer's vaccine is available for use in those 12 years of age and older. The primary vaccine series is a 2-dose series. It's given 3 weeks apart. Pfizer's vaccine is shown to be anywhere from 86 to 95% effective in preventing hospitalization and mechanical ventilation. The most common side effects are injection site, fatigue, chills, and muscle aches, which generally last 24 to 48 hours. These are more common after the 2nd dose. An additional dose of Pfizer is also authorized for use in those with a weakened immune system. Now, this is given to patients that did not mount an adequate doses, and it should be given no sooner than 28 days after the last dose of the primary series. We all know about the booster doses. It's been widely covered. The booster dose is now authorized to be given to those greater than 65 years of age and older, but it may also be given to those 18 years and older at high risk of severe disease due to underlying health issues or whose occupations increase the risk of severe disease. And the booster should be 6 months after the last dose of the primary series. Next is Moderna. Moderna's vaccine can be used in those 18 years of age and older. It also is a 2-dose series, but it's given 4 weeks apart. Moderna's efficacy and side effects are similar to Pfizer's. Both Pfizer and Moderna have the rare adverse event of anaphylaxis, which is severe allergic reaction associated with difficulty in breathing, which is why individuals must be monitored for 15 minutes after their dose. They also have the rare event of myocarditis or pericarditis, which is inflammation of the heart muscle or heart lining, which which primarily occurs in males under 30, around 7 days after the second dose. Now, both of these are extremely rare, but as a pharmacist and a healthcare provider, I would be remiss if I did not mention them. The last of the COVID vaccines available in the US is the Janssen Johnson Johnson vaccine. Now, this is a single dose vaccine. It's available for use in those 18 years of age and older. The most common side effects of Johnson & Johnson vaccine is pain at the injection site, redness, and swelling at the injection site. Johnson & Johnson has shown